Hi, this is Dr. David Klein at the Stages of Life Medical Institute in sunny Longwood, Florida. We just survived a tornado on top of this COVID crisis. So wouldn't you know it, we're probably waiting for frogs, locusts, whatever the next plague happens to be coming. And it will. So what I'm going to discuss with you right now is something that you probably have not done, and it's called financial health planning. What can you do to plan financially to deal with health and health crisis? Everybody thinks, oh, well, I've got a savings account, I've got a 401k, I've got an IRA, I've got this, I've got that. But they really don't have a clue as to how to handle their health expenditures. And it's a major part of many families' life. Now, when you're young, when you're 18, 16, when you're 25, when you're 30, perhaps, you really don't think in terms of disasters. You don't think too much in terms of what you're likely to need, what you might have to have. So, like everybody else, I went without any health insurance until I was 35. Boy, did I luck out, okay? Because many of my friends didn't. Some of them actually got very, very sick and were wiped out financially. So what you want to do when you're a youngster, okay, if you're listening in and you're in your 30s, if you're older, okay, and you have kids, you may want to talk to them about this. And that's getting insurance, health insurance, even if you can't really afford what you think you ought to have, with a very high deductible. Why? Okay, because the odds of somebody ending up with a $5,000, let's say expenditure in any given year is actually pretty small, unless you're on these expensive medications, and you can probably do it less expensively anyway. So most people can get by with a $5,000 or $10,000 deductible and then stay healthy. Okay, that works just fine. And then what do? You go ahead and you start self-insuring for the disasters. And this is really where the meat and potatoes is going to be. So you can get traditional health insurance. You can go out and get Blue Cross Blue Shield, Aetna, Cigna, whatever. They're all pretty much the same. Okay, a little bit different here, a little bit different there. Some of your states may not have any options for you. You may only be able to get one insurance, as it is here in Florida. Then you get the non-traditional insurances. These are like group co-insurances. If you happen to look at some of these church groups, they actually work pretty well. You pay into it as if it were an insurance, which it kind of is. It's a mutual insurance company. And then you hope, pray in your case, not to get sick. Wouldn't you know it? But then it gets into the fun stuff, and it's the self-insurance. This is where the smart money goes. Now, what is a self-insurance? This is what your big companies do. They'll go out and say, well, we have 10,000 employees and we have Aetna. They don't have Aetna, okay? They're self-insuring. It's called a TPA, but Aetna may actually administer for them. That's their agency to say, no, you can't have that, all right? They don't really buy insurance. It is an administrative plan. Total program administration, wouldn't you know it? So you can actually do this yourself. You can make your own TPA. It has a different set of letters attached to it. It's called an HSA, or Health Savings Account. So if you know that you have a $5,000 deductible, why not take $5,000 out of your income if you can afford it? If you can only afford $1,000, you put that in there, into the HSA. Now, this is not an insurance product. Do not confuse this with the one that you're likely to be sold by the insurance company, which is, you pay in, and if you don't use it, they keep it. That is not self-insurance. That's stupid. Okay? That is just not the way it ought to be done. So you can go to a brokerage. Merrill Lynch is my favorite for this, and they will set you up with an HSA. You put money in there. They put it into some type of mutual fund. You can direct it as any way that you choose to. And then you hope not to use it. Or you can use it to pay your dental bills, your eyeglasses, your medications, any way you see fit. And that would take care of what you would consider to be your deductible and copays. If you allow it to roll over year to year, it accumulates like an IRA. That is the power of A, staying healthy, and B, just being a little bit of a spendthrift. Okay, you don't need designer eyeglasses, okay, and then pay for it out of your HSA. You can use your IRA very much like a health savings account as well. Why? Because you're allowed to take money out of it for certain types of catastrophic problems, all right? That is not a benefit of an IRA. And the last piece is a 529 plan. These are intended to be used for educational expenses, but there are exceptions. My recommendation is to go with the HSA. It's easy. It's easy to set up. It's inexpensive, and it makes a big difference. What else can you do for your financial health? Okay, or your healthy finances? And that's actually to go into bulk buying. So what does this mean? It means that you're going to get a break when you buy 90 days worth of your medications at one time. This is not a joke. And if you've got something that costs you $500 or $600 a month, I don't think so. But most medications are very, very inexpensive, and much of the expense is the pharmacist's time putting it in the bottle. So if you know you're going to be on something, ask them for 90 days. Ask them for 180 days. It'll save you a lot of money. Non-traditional prescription plans. Okay, this is actually kind of cool. There's several out there that are kind of neat. GoodRx, it's probably the first to come around. My favorite's called CleverRx. And so what you can do is you can get these things as apps on your phone, and you can shop your generics. Nobody makes coupons for generics because there's not one manufacturer involved. There might be 30. But CleverRx is a buyer's club. What do? They take your data and they vend it. In return for that, you pay less for your medications. So I do this. I recommend it to my patients. It seems to work well for them. And they stick the money in their pocket. The place where the biggest margins are for the pharmacies, things like pain medications. So it can save you a lot of money if you're taking antibiotics, pain medications, and some of the psychiatric medications in the generic form that can be very, very cheap if done this way. Canadian pharmacies. Okay, I never really liked the idea. I still don't really like the idea, but if you're hard-pressed for cash, you can buy your things through the Canadian pharmacies, which gives you a direct shot at the pharmacies in India, which is really where it all comes from. Okay, but you have to be careful with this. Equipment at home. Every home should have a blood pressure cuff. Every home should have a thermometer, not the ones that are filled with mercury, but one of these electronic ones. Why? Because you can save yourself a lot of money going to the doc in the box by knowing that you really don't have a fever or that you really do have a fever. Okay? So a thermometer used to be standard fare in homes. Not so much anymore. A lot of people think it's beneath them to have these sorts of devices around. Blood pressure cuff. What else do you want? First aid equipment, first aid medications, and manuals, not your telephone and not your computer. In the event of a disaster and you can't get online, it'd be really nice to know how and where to put medications and which ones to use. So just a first aid manual wouldn't be a bad idea. This is something that was standard in every household up until this probably the last decade. Keep your prescriptions up to date. What does this mean? It means don't wait until the last minute to fill things. Okay, you want to be able to get a little ahead of it if you can. If you're getting 90 days or 180 days or whatever at a clip, then you can always stay pretty well ahead of it, because having a problem with blood pressure in a time when everybody can't get out of their house, or you can't get a ride, or you can't get on the road, this is a major issue. And keep copies of summaries of your medical care at home. Because if you have to flip to the emergency room, they're not going to listen to you. They may not even be able to hear you. You may not be able to speak. It's really nice to be able to say, here's a list of my medication and dosages, okay, so they can assess you and deal with you appropriately. This is Dr. David Klein, hoping that you're going to do a little of this or a little of that, but at least take some of this advice, because I'll tell you what, believe it or not, it's pretty good advice. Have a pleasant day. Again, Stages of Life out.